Hello students, let's study vectors and zoonotic infections. So vectors, the transmission of infectious agent from reservoir or source of infection to a susceptible individual can be by various vehicles and vectors. So vector is an arthropod that transports a pathogenic organism from infected to non-infected host. This can be passive transport, that is mechanical vector, or essential host in the life cycle of pathogenic organism called as biological vector. So these are the few examples of vectors. So mosquito, Culex causes Bancropian filaria, Japanese encephalitis, West Nile fever, viral arthritis, malaria, Louds, epidemic typhus, relapsing fever, trench fever. Mosquito Aedes causes Aedes aegypti causes dengue, dengue hemorrhagic fever, chikungunya fever, Rift Valley fever, yellow fever. Sandfly causes Kala Azar, cyclope, guinea worm infection, rat flea, bubonic plague, endemic typhus, chiggerosis. Hard tick typhus, Casanova forest disease, tularemia, soft tick Q fever, endemic relapsing fever, testis fly sleeping sickness, house fly, typhoid, paratyphoid fever, dysentery. Hello students, let's study zoonotic infections. So zoonosis is any disease or infection that is naturally transmissible from vertebrate animals to humans. Animals thus play an essential role in maintaining zoonotic infections in nature. Zoonosis associated with bacteria, virus, parasitic or fungal agents. Classification: Anthropozoonosis, infections transmitted from animal to man. Zooanthropognosis, infection from man to animals. Amphixenosis, infections that are maintained in both man and animals that may be transmitted in either direction. So these are the important list of the zoonotic infections. So bacteria, anthrax, animal herbivores, plague, animal rat, brucellosis, sheep, goat, camel, Pasteurella infection, dog, cat, rat bite fever, rodents, leptospirosis, rodents, non-typhoidal salmonellosis, poultry, bovine tuberculosis, cow, endemic typhus, rodents, tularemia, rabbits. So viruses like rabies, dogs, yellow fever, monkey, Japanese encephalitis, pig, Casanova forest disease, monkey, chikungunya monkey, monkeypox monkey, Bryan disease cattle, hemorrhagic fevers, rodent cattle animals, influenza pigs, birds, some fungi, histoplasma cattle, sheep, coccidioides dogs, paracoccidioides dogs, blastomyces dogs, pneumocystis jirovecii, rodents, cryptococcus, wide variety of animals and birds, parasites, toxoplasma cats, leishmania dog, tinea pigs and cattle, Echinococcus dog, Cryptosporidium cattle, Fasciola busky pigs and cattle, Trichinella pigs, hookworm, roundworm dogs and cats. These are important list of zoonotic infections: plague agent Yersinia pestis, bite of infected rat flea; anthrax Bacillus anthracis, animals infected by ingestion of spores in soil; brucellosis Brucella melitensis, animal food products; bovine tuberculosis Mycobacterium bovis, ingestion of infected milk; leptospirosis L. interrogans, direct indirect contact with urine or blood of infected animals; salmonellosis Salmonella typhimurium and S. enteroideus, ingestion of animal food products; psittacosis Chlamydia psittaci, inhalation of aerosols; tularemia Francisella tularensis, interaction with biting or blood-sucking insects; rat bite fever Streptobacillus moniliformis pyrelium minus, transmitted by contact with rodents carrying disease bacteria; cat scratch disease Bartonella hensleyi, cat scratch or bite. How pathogens spread between animals and people. Vector-borne contact with living organism that carries disease pathogen. Direct contact, coming into contact with body fluids of infected animal. Indirect contact, coming into contact with areas where animals live and roam or surfaces that have been contaminated with pathogens. Foodborne, consuming infected food. Waterborne, drinking or coming into contact with contaminated water. Yersinia pestis, mode of transmission, bite of infected rat flea, most common, direct contact with tissues of infected animal, that is rodents, droplet inhalation, man-to-man, pneumonic plague. Pathogenicity, plague, clinical types 3. First, bubonic plague, most common, sudden onset fever, malaise, headache, painful lymphadenitis, buboes. Regional lymph node stains, tender swellings called buboes. Common site inguinal, other axillary, cervical, submaxillary, cannot spread from person to person without treatment. Dissemination occurs leading to implication of pneumonia and meningitis. Pneumonic plague spread inhalation of bacilli in droplets expelled from another person or animal with plague pneumonia. Manifestation, sudden onset fever, headache, respiratory symptoms, and highly infectious, fatal. Agent of bioterrorism. Septicemic plague, secondary septicemia plague is more common than primary. Spread of bubonic or pneumonic plague. Hemorrhages in the skin and mucosa, gangrene of affected site, black death. Lab diagnosis specimen, bubonic plague, pus or fluid aspirated from mucus, pneumonic plague, sputum blood, septicemic plague, blood and splenic aspirate. Transport medium, caribulary medium. Gram staining, gram negative oval cocobacilli surrounded by capsule. Methylene blue stain, bipolar safety pin appearance. Culture, Vipestis blood agar non-hemolytic dark brown pigmented colonies because of the aspiration of the absorption of hemine. Mekonki agar lactose non-fermenting colonies. Bacillus anthracis, transmission cutaneous mode, spores entering through abraded skin, inhalation of spores, ingestion of carcasses of animals dying of anthrax containing spores. So clinical types are cutaneous anthrax, pulmonary anthrax, intestinal anthrax. Rare intestinal anthrax rare due to ingestion of spores. Lab diagnosis, specimen collection, pus or swab from malignant pustule, sputum in pulmonary anthrax, blood in septicemia, CSF in hemorrhagic meningitis, gastric aspirate, feces, food in intestinal anthrax, earlobes from dead animals. Gram staining, gram positive, large rectangular rods. Spores are usually not seen in clinical samples. McFadden's reaction, methylene blue capsule appear as amorphous purple material surrounding blue bacilli. Direct immunofluorescence test useful during bioterrorism outbreaks. Capsular and cell wall polypeptide antigens detected. Scully's thermoprecipitation test, it is a ring precipitation. Then when sample is received in putrid form or bacilli are non-viable. Culture nutrient agar frosted glass medusa head appearance. Brucella, the obligate aerobic fastidious small gram-negative Coccobacillus species Brucella militensis, pathogenic to sheep, goat, and camel. Man is also susceptible host. Brucella abortus acquired from cattle and buffalo. Brucella suis infects most often pigs. Brucella canis causes abortion in dogs. Pathogenicity, human, brucellosis, undulant fever, Malta fever, Mediterranean fever. Primarily zoonotic disease affecting various domestic animals such as sheep, goat, and cattle. Human infection associated with occupational or domestic exposure to infected animals or their products. Pathogenesis, transmission from infected animals to man by various modes. Direct contact of abraded skin or mucosa with the infected animal tissue, blood, urine. Spread from initial site of infection, the organism spread to bloodstream resulting in bacteremia and then disseminate to involve various organs. Organs involved reticuloendothelial system such as lymph nodes, spleen, liver, bone marrow. Other organs such as placenta, musculoskeletal tissue, genitourinary system. Clinical manifestation, classical pride, profuse night sweats, arthralgia or arthritis, and hepatosplenomegaly. Foul smelling perspiration is considered as classical sign but not uncommon. Typhoid-like illness, except that it is less acute, less severe with undulating pattern of fever and more musculoskeletal symptoms. Undulating fever, typical remittent course that is in between febrile periods which last for weeks. There will be afebrile periods. Malta fever or Mediterranean fever. Musculoskeletal symptoms, vertebral osteomyelitis, septic arthritis. Other non-specific symptoms, abdominal pain, headache, diarrhea, CNS, CVS, and genitourinary manifestations also seen. Laboratory diagnosis of brucellosis, specimen blood, bone marrow. Blood culture by Castaneda biphasic medium, BHI broth or agar, automated techniques such as Bactec and Bacti alert. Culture smear and motility testing reveals non-motile gram-negative coccobacilli. Biosafety precautions, highly infectious pathogen, all laboratory procedures should be carried out with adequate biosafety precaution. Identification by automated identification systems such as MALDI-TOF or VITEC or by conventional biochemical test. Brucella is catalase and oxidase positive. Urease test rapidly positive for Brucella suis and canis. Serological test, antibody detection, standard agglutination test detects IgM. Test to detect IgG antibody are 2-ME test and ELISA. Diagnosis of brucellosis in animals, milk ring test, Rose Bengal card test detecting antibodies in infected milk. So to summarize Leptospira is antigenically complex, comprises of two species, Leptospira introgans and the Biflexa. Biflexa is the commensal flora. Morphology, Leptospira are actively motile, delicate spirochetes. They have large number of closed spirals and hooked ends. They are very thin, not seen under light microscope. They are seen under dark ground microscope or electron microscope. Pathogenicity, leptospirosis, zoonotic disease. Source, rats, dogs, cattle, pigs. Man is infected when leptospirosis in water contaminated by urine of animals enter body through gut, skin, nose, mouth, or conjunctiva. Clinical manifestation, mild unecteric febrile illness, 90%, biphasic septicemic phase and immune phase. Wills disease, hepatorenal hemorrhagic syndrome, 10%, severe form of ecteric illness, present complications, meningitis, bleeding. Laboratory diagnosis, specimens first 10 days CSF, blood, urine between 10 to 30 days, urine. Microscopy, wet films, dark ground or phase contrast microscope, staining, silver impregnation stain, Fontana stain reveals spirally coiled bacilli, tightly and regularly coiled with characteristic hook ends like umbrella handle. Isolation, culture condition 32 degrees Celsius for 4 to 6 weeks. Medium EMJH, Ellingausen, McCullough, Johnson, Harris, medium. Korotkov or Fletcher and Stewart's medium. Serology for antibody detection, serovar specific test, microscopic agglutination test, gold standard test detects antibodies against specific serovar of the L interrogans. Microtiter plate patient serum plus live antigen suspension of various leptospiral serovar endemic in the locality, incubated for 2 to 4 hours at 30 degrees Celsius, then examined under dark ground microscopy for presence of agglutination. Immunochromatography test, it detects IgM and IgG antibodies. Molecular PCR, non-specific, LFT and RFT deranged. Francisella tularensis, tularemia, primarily a plague-like disease of rodents and other small animals. Clinical manifestation, ulceroglandular tularemia, ulcerative lesion at the site of inoculation with regional lymphadenopathy. Pulmonary tularemia result from aerosol inhalation, laboratory workers, and can spread to lungs following bacteremia. Atypical pneumonia, oropharyngeal tularemia following ingestion of contaminated undercooked meat, membranous pharyngitis with cervical lymphadenopathy, lemming fever in Norway results from congestion of water contaminated with excreta of infected lemmings, oculoglandular tularemia, purulent conjunctivitis with pre-auricular lymphadenopathy, typhoid-like illness, agent of bioterrorism. Francisella tularensis is currently classified as category A agent of bioterrorism. Lab diagnosis of tularemia, specimen ulcer scrapings, lymph node biopsy, gastric washing, sputum and blood. Culture highly fastidious, needs special media, BCG agar, blood cysteine glucose agar or CHAB agar, cysteine heart agar supplemented with 9% heated sheep blood. Safety precautions such as biosafety label, small gram-negative coccobacillus with bipolar appearance, non-motile, encapsulated, weakly catalase positive, oxidase negative, H2S positive. Other methods, direct fluorescent antibody test, PCR. Agents causing rat bite fever, Streptobacillus moniliformis, Haver Hill fever, septic fever, skin rashes, painful polyarthritis, frequent relapses. Spiralium minor, Sudoku, additional lymph node enlarged. Lab diagnosis microscopy gram negative better stained by Giemsa or Fontana stain, small rigid spirally coiled bacilli, motile, amphitrachus flagella. Culture cannot be cultured in artificial culture media grown by inoculation into guinea pig or mice. Bartonella, three important human pathogens, Bartonella henselae, Quintana, and Bacilliformis. So they are fastidious, facultative, intracellular, slow-growing gram-negative bacteria, ability to invade mammalian cells and RBCs. So bacteria henselae causes cat scratch disease, bacillary angiomatosis, bacillary paleosis, bacteremia, and endocarditis. Lab diagnosis, specimen, blood, lymph node, or skin biopsy, microscopy, Warden, starry, silver nitrate staining and immunofluorescence staining detects B. Hensley from lymph node smears. Culture Bartonella can be grown on blood agar at 37 degrees Celsius and incubated for 12 to 15 days. Antibody detection, both indirect immunofluorescence assay and enzyme immunoassay based methods are available. Detects antibodies against B. Hensley and B. Quintana separately. PCR done to amplify the genes such as 16S rRNA gene. Role of nurse in vector-borne disease control. Vector control, anti-adult measures, residual insecticide spraying, diphenyl trichloroethane (DDT), malathion, phenyltrethione is highly effective against adult mosquitoes. Application of pesticide in form of fog. Individual protection by using insecticide-treated bed nets, repellents, and protective clothing. Anti-larval measures, larvicide, use of mineral oil or Paris green to kill mosquito larvae and pupae. Source reduction, mosquito breeding sites includes environmental sanitation, water management, and improvement of the drainage system. Biological larvicide, Gambusia in fish and Bacillus tunis bacteria can be used to kill the mosquito larva.
Hope you find this session useful for your understanding and for your exams. Thank you.